Well, thank you everyone for joining us today. We will be beginning, and I'm sure people will be trickling in more and more, but we appreciate you being here. And again, this will be recorded. In the meantime, we are putting our names and where we're joining from. First of all, welcome everyone, and thank you for joining us today for this webinar, Worry Less, Do More. When we participate and vote, we exercise our agency. My name is Mario Bañuelos, pronouns he, him, or él in Spanish, and I am with Community Health Worker, the APHA CHW section. I have the pleasure of moderating this important discussion, co-hosted by the APHA Mental Health section and the Community Health Worker sections. And today, we'll explore how civic participation, particularly voting, is crucial to both mental health and community well-being. When we vote, we strengthen not only our political system, but also the fabric of our communities and expanding opportunities for connection and empowerment. So before we begin, though, let me introduce our fantastic panelists. First, we have Brandon Graham. Brandon is the Director of Advocacy of the National Alliance on Mental Health, Mental Illness, or NAMI, the nation's largest grassroots mental health organization. Brandon serves as Director of Advocacy there. And let's see here, leveraging NAMI's voice and stories of lived experience to transform policy. He directs and executes advocacy campaigns to achieve NAMI's policy goals, such as NAMI's hashtag Vote for Mental Health and hashtag Reimagine Crisis campaigns. Brandon also leads efforts to expand the organization's advocacy presence on social media, driving the expansion on NAMI advocacy on Twitter. Brandon has worked in policy at the Democratic Governors Association in field organizing on federal and state level campaigns, and served as Deputy Regional Director with the Office of U.S. Senator Chuck Schumer. So welcome, Brandon. Also next we have joined with us by Luke Cicchini, the Public Policy Director for the Alliance for Rights and Recovery, formerly NYAPRS, where he supports the Alliance's grassroots community and advocacy and leads statewide and national public policy and engagement efforts. Luke is a first-generation Kenyan American with an undergraduate degree in psychology from New York University and a master's in public health from Johns Hopkins University, Bloomberg School of Public Health, with a focus on health education and health communication. His advocacy interests developed through his work in NYC Clubhouse and evolved into a focus on policy through his work in Baltimore on national mental health advocacy with the College for Behavioral Health Leadership. This past Tuesday, Luke was honored as Emerging Advocate of 2024 by Brazilian Center for Mental Health Law. So congratulations and welcome, Luke, as well. And also we have Mary Jane Alexander. Mary Jane, would you like to introduce yourself as well?
Yes, hi, thank you. I'm Mary Jane Alexander. I'm the past chair of the mental health section, and my interest in this work comes from a consortium that several of us on this panel joined with Ron Manderscheid to really energize people in the behavioral health community this year and to get out the vote, really to encourage and engage people in civic participation. I'm on the policy committee in the mental health section, and this is really important work that we're doing this year. So I as someone who really helped put this together, I welcome you to this important work. Thanks.
Thank you, Mary Jane. Together, our panelists will guide us through thought-provoking questions, such as what are key barriers preventing people, especially those facing behavioral health challenges, from voting? What innovative solutions have been effective? How can we encourage ongoing voter participation? And resources will be shared as well. And again, this presentation will be recorded and resources will be shared with everyone. So throughout today's discussion, we encourage you to participate by asking questions in the chat box. Depending on how it goes and how it flows, we may address them live or through the chat at the end of the presentation. But first, let's go ahead and Mary Jane will talk about the importance on social determinants of health. And voting. So Mary Jane, take it
Yeah.
away.
Yes, thank you. I'm just going to talk very briefly because we have these two great panelists who've been out there really doing this work. So I just want to tell you that that there is this public health background around the importance of voting as a individual determinant of individual health and community health. Our little consortium that I mentioned a few minutes ago, we put together this wonderful, I think it's a wonderful graphic, and I see that Luke will share it in a much larger way. This graphic is free for you to use. If you are trying to activate your community, you can print this, you can make flyers, you can make postcards. If you have t-shirts, which I'm sure you're not making t-shirts, but if you were, you could put it on that. You do anything you want with this. It's free for you to use. And what it does is it puts out there what the evidence really is. APHA is about science, action, health. And this graphic is really the evidence for voting as a social and political determinant of health. I realize that I didn't put the formal citations for all of this in the in this document. I will do that in the edited document. You'll have it available to you. I see that all the folks from Langston are from Oklahoma. So if you need this or anything academic, you're welcome to it. I will put those in there. I also just want to point out the scope and the power of the behavioral health community. In the late 90s, only about 12% of people with disabilities were participating in elections. And by 2018, 2022, that was up close to 50%. Well, we want to get it up farther. We really want to enhance the power of the behavioral health community, because civic engagement is not just an important determinant of wellness, but it's also an important determinant of policy. So these numbers, I think, are really incredible. We make up, if you count people in the and these are not, of course, partisan numbers, but any people in the US with any behavioral health condition in the prior year, that's the National Survey on Drug Use in Household, that's about 66 million people. There are 1.2 million professional behavioral health providers, and I didn't think that was a complete count. And there are 24 million paraprofessionals and peer providers and supporters. Of the 233 million US adults, that's 40%. Our voice should be loud and clear and influential. And this is not just a short game. This is not just about voting this November or voting next year. It's a long game. And being involved both in terms of electing your local officials, holding them accountable, getting involved in policy. If you're and you are an APHA member, if you're on this call, get involved in policy statements, get involved in determining what the action steps should be for our membership. And we can influence issues that are incredibly important for the mental health community, for people to live decent, dignified, and distinctive lives, to have freedom from violence and coercion, to have basic living standards, to have access to healthcare and mental health care. Parity laws are so important. It's been such a long, hard slog. Work, access to employment opportunities, not just to be able to work, but opportunities within the workforce. Education, don't take away the opportunities for kids in school to have IEPs, to have special needs met. And in general, disability rights and protections. And that is what I have to say. Really, all those in that previous slide, all those hands that are raised with all this, that's the diversity and the power of this community. And I really hope that you feel it and that you take some action based on it. That's me. I think you're next. I give it back to Mario.
Thank you so much, Mary Jane, for those very important points. So now we'd like to talk a little bit about voter engagement and activation. And I have some questions. We have some questions that we put together for our distinguished panelists. And so let's begin. Remember, you can go ahead and write your questions in the chat box as well, and we'll be able to go ahead and answer them as we have time in the flow. So let's begin. To our panelists, what are some of the key barriers that prevent people, especially people who struggle with behavioral health challenges or people who work and study in the field, from voting? What are some key barriers that prevent people from voting?
Luke, after you.
I was wondering how we were going to do this. This is the problem of mental health advocates. Everyone's always about voice and choice, so we're trying to make sure everyone's voice is there. I thank you once again for having me. First of all, like I was introduced, my name is Luke Sakinya, and I work with the Alliance for Rights and Recovery. I first and foremost want to say that I'm a person in mental health recovery, which is part of what brought me to this work. And I think when we talk about our community, one of the biggest things is there's this feeling that just voting isn't going to be enough to change things. This feeling like our individual vote doesn't matter so much. The number of times I have heard, well, I would vote, but I don't know if it really matters, and I don't know how that actually affects, anything that happens in my life. But I also know that so many people want to be active and want to see their politicians really change things on their behalf. And I think, having the challenges of having a mental health challenge means that it is a little bit harder to get through the process of voting. When we think about what that means, that's registering, that's finding your polling place, that's determining what people who are running for elections actually believe in and whether you agree with them on those things, and then parsing through all the details of policy that can sometimes be really complicated and hard to find, and then figuring out when I'm going to go vote, where I'm going to go vote. For folks, who deal with depression, thinking about, how to create a plan to vote that ensures that no matter what the day is like, on that faithful day of actually voting, making sure that you get your vote in. I think there's a lot of anxiety and fear that often comes up with voting because we both want to participate, but also don't want to make the wrong decision, and also don't want to have to go through the trouble of, getting accommodations sometimes for voting. So those are some of the things that we often hear, along with, a lot of our community also bridges the gap between the criminal justice involved community, and really looking at what the laws are in your own area, state, and otherwise about voting with a criminal justice record, or voting while in a hospital, or other sort of treatment services. So those are some of the things that we have seen and heard from the community.
And thanks, Luke. I think that's great. And hey, everyone, I'm Brandon Graham. I use he, him pronouns. I'm NAMI's Director of Advocacy at our national office. We're America's largest grassroots mental health organization dedicated to building better lives for all people affected by mental health conditions. I can now say that in one breath. I have a background in elections and campaigns, but I am also someone who lives with a mental health condition, a suicide attempt survivor, and someone who wants to channel that lived experience into passion. And I think something that is really important to think about, in addition to the barriers Luke has described, are the rest of the systemic issues in place, whether that is navigating voter ID. Do you have an updated ID? Are you registered because you have moved apartments, or you're struggling to find supportive, safe housing, and you need to make sure to keep updating, but your ID isn't updated enough and you don't have the ability to go and get a new updated ID. And there are all those barriers in place, but there's also the political ones. I don't mean that in a term of who's winning what race. It's campaigns spend their money churning people out who they know are going to vote for them. There's only so much money and so much time in a day. But as Mary Jane said, we've made lots of strides in getting people more engaged in the process, but we still have more work to go. And that's why all of us as advocates, as people who care about civic engagement, can build an electorate that looks like our communities, not just like the likely voters for a particular campaign. And I think so often you won't have folks who receive some of that get out the vote effort, or receive those mailers, or get information sent to them about where their polling place is, because they haven't had a history of voting before. And just because you haven't voted in a previous election doesn't mean you can't be a mental health voter, doesn't mean you can't go and be part of this process. And I think that's why it's so important that all of us on the call, nonprofits out there, mental health professionals, public health professionals, that we see voting as just central to building a healthy democracy and a healthy society that we are all able to participate in. So navigating the fact that campaigns are going to spend all of that money to turn out their supporters first and foremost, it's up to all of us to make sure we're talking not only with maybe the people we serve or the people we work with, but even our friends and family, people in our networks, and spread the word that way.
Amazing. I really appreciate those thoughts and encouragement. Well, let's move on to I'm already thinking about things. Who am I going to talk to? But let's move on to the next question. What innovative solutions have you seen work effectively to reduce barriers and engage people in the voting process?
I'm happy to jump in first this time. So I think there's some of it comes down to the innovation can be the simplest thing. There are a lot of organizations out there, and partnership can be one of the best ways to help navigate those barriers. At NAMI's national office, we partner with organizations like Vote Riders, which helps connect people with voter ID and how to secure an ID in their state. Working with the League of Women Voters, perhaps in your community, who has an amazing website. I want to send you to all of my resources. I definitely do. But vote411.org is an amazing tool for anyone who may not have the ability to go through and find all of the deadlines and find all of the places to send people to find some of these resources. So it's partnership first and foremost, and then your relationships. Relational organizing is a key part of navigating some of these barriers, helping someone you love make a plan, helping your friends know, all right, where to start? Where do you register to vote in your community? How do you look up your polling place? Hey, we're in the same precinct. Did you know we can early vote right around the corner and it starts tomorrow? In Virginia, for anyone calling from Virginia, early voting does start tomorrow. So just a heads up there. But some of those, just having conversations with people in your network, in your community, to check in, like, hey, we don't need to talk about the politics of it all, but you've got your plan to vote. Like, are you going to go before work? Are you going to go after picking up your children from daycare? Like, what is your plan to go? And having some of those conversations and being that resource for others. It can be challenging to start. It could also be challenging to have that conversation. But having some of those resources in place, doing your own research, and then helping others, those relationships really can help people navigate some of these barriers.
Yeah, I think, just to add on there, I think it really is about education, connection to those resources to get more information, and then that relationship aspect. I think you really cannot stress enough that relationship part, really just being able to say that, demystifying the difficulty and complexness of this. We want to make sure that people know that this isn't that hard of a process once you get into it, but it's the starting and it's the going through some of it that can seem a little daunting. But for us, I love that Brandon mentioned the League of Women Voters, because we have been very actively partnering with them in New York. We've also been partnering with New York's NAMI chapter, the mental health associations in New York State, and other statewide organizations like Families Together here, to really get a bigger reach for folks. We know that we all have different groups that we connect with, different pockets of the mental health community that we connect with. And, for us, we put on an event last month just to say, here's all of our groups coming together saying we all need to vote. We're not going to tell you how to vote, but what we want to do is give you all the information needed to vote and give you quick resources to vote. We've had our Mental Health Association in New York State has put together short videos for how to, think about voting, how to create plans about voting. We've got postcards, we've got all this different information, all these different tools, because everyone responds to things differently. And we want to make sure that we have something for everyone, thinking about language differences, how we can get all of these things to folks and how we can really just make it easier for people to vote and feel comfortable voting and feel confident in doing so. I think that's been a really big push for us, and that partnership has been a key part of that strategy.
Awesome. You talked a little bit about this, and but how could someone on the call right now collaborate with others to increase that voter participation? You touched a little bit about on these things, but what other things could people do to increase this voter participation?
Yeah, I think really it starts with knowing your community. I think knowing who knows who, really, and combining and looking at and thinking, especially when we come from the advocacy space, we all want what is best for the individual, what is best for our community, and being able to say, okay, you touch youth, so you have a very strong connection to the youth in our community. You have a strong connection to some of the centers where people are receiving services. How can we put something together that really looks at, their approach, their sort of lens to this issue, and thinking about what their barriers are in particular, and crafting things for those communities, for those barriers, and being able to partner with folks who have a little bit more knowledge. For us, we are putting on candidate forums, so you can go out and hear from candidates and interact with them. But me personally, I haven't done a lot of candidate forums, but the League of Women Voters have, and they have local chapters that we'll partner with to host those candidate forums and get our folks out there so that they can get the candidates, we can bring the people. It really is a beautiful partnership, and similar to the way we have worked with NAMI and other state organizations here in New York. It's really about getting the right group of people together and then not trying to reinvent the wheel. We know that, for instance, NAMI has a lot of phenomenal resources on voting. So how do we spread that to people? How do we make sure that people are aware of that and direct them there when needed? And other places, if other folks have valuable information as well.
I mean, Luke said something great before about just basically no wrong door for people to get involved in this. And I think that not only applies to voters to find information, but that also applies to all of us. We partner with our friends at Nonprofit Vote. So Nonprofit Vote is an organization that I'll give a quick shout out to that has a lot of resources for people who are like, well, I don't know where to start, but I want to avoid looking partisan. What can I do? They have these guides that help you get started, but they also have research. And I know, as Mary Jane said before, making sure we've got the data and the research to back things up. And Nonprofit Vote did a survey. It's a few years old now, but it found that nonprofits who start sharing information with people reach an audience that is so much different from a traditional likely electorate. It's 2.3 times more likely to reach non-white voters, 2.6 times more likely to reach voters under 25, 1.9 times more likely to have reach voters who have under a $30,000 household income. And in general, people who are contacted and encouraged to turn out and vote by nonprofits in a nonpartisan way turn out 11 percentage points higher than comparable voters. That's all possible because we live in an era of disinformation and misinformation. It's just a fact of the current situation. But you know who people trust? Their community organizations, the nonprofits that they're turning to for help, the universities, their employers. And it's up to us to just start the conversation, share those resources. The previous Tuesday was National Voter Registration Day. It's a non-partisan holiday that just encourages people to register to vote. And by just sharing those resources, it can help reach different audiences and cut through some of the noise about what is true or what is false, or even to the earlier point about my vote doesn't matter. And hearing from those people, just sending out that email or sending those resources, giving your staff, if you have a staff that you manage, paid time off to go vote if you can, doing steps like that where you're just like, I'm creating the space for you to engage. That helps get people on that ladder to civic engagement. Sharing that email, sending that information, not putting your finger on the scale, just providing these resources. that can help get so many more people involved.
Yeah, I appreciate that. And I appreciate all the information that we're providing here is nonpartisan, just information and on all the resources that will be shared are also nonpartisan. So providing just information for everyone to engage in the voting process. I'd also like to ask, how can we better communicate the importance of voting to those community members who may feel disconnected from the political process or just simply overwhelmed by their personal challenges? How can we better communicate the importance to these community members?
I think some of it comes down to, especially when we talk about mental health and voting, we're already voting on mental health, whether we know so or not. The people we elect at every level of government, from the White House and Congress to Albany and your state legislature to your local city council, even your school board, oftentimes there's going to be a decision made that impacts the availability of mental health care, mental health services and supports in your community. Now, that should be a galvanizing thing to realize, because so many people look at, here are the big names that are on this top of the ticket race, but it's all in our community. It's all of the time. And helping people realize that, you know what, I may not see a ballot initiative because I don't live in a state that's putting mental health literally on the ballot, but these decisions I make, they impact mental health. I care about these other top issues in a election, from education to jobs in the economy to housing. These are all mental health issues. Mental health is not a monolith. Mental health is not just healthcare. We can help people realize that, hey, the things you care about in your community, those impact people with mental health conditions. Those impact family members. Those impact all of us as professionals. We need to get involved, because you know what? One vote can make the difference. There was that race in Virginia only a few years ago where it was such a tie after recount that they picked a winner out of a decorative bowl. That is a clear example that one vote does matter. Your vote matters, and it matters a whole lot for the 1 in 5 people affected by mental health conditions.
Yeah, I can't really add too much more to that, Brandon. I think that's perfect. And also thanks for the shout out for Albany, New York. I think the big thing to really stress there is that local aspect. I think we often talk about the fact that, yes, the big ticket item, the big ticket folks, the senators, the representatives that are going to Congress are really important. But when you think about what actually affects you very quickly, it's those decisions at the local level. It's the folks who are coming in, at your state level, senators or legislators, sometimes your local county executives who really determine how money is moved into your community within the next year. So really explaining to people, educating people on that process of how the government works in the local communities, and how much effect that this vote has on those local decisions and the decision making of your local legislators is massive. And ensuring that people understand that first and foremost, and then ensuring that people have enough information about how their legislators are planning to vote, or what sort of positions that they have already, and then thinking about what they would want already, what you as an individual would want for your community, and where do these candidates align with that. I think that's been a massive area where it's kind of considering how you can bring about the things that you want in your community, and then bringing that to your local electeds, and then voting for those local electeds to ensure that the ones who are, in line with what you want are there.
You mentioned understanding, and so in terms of understanding, what are some tools or platforms that have been successful in helping individuals register to vote, or just understand their voting rights?
Yeah, I think, I'll tip my hat to NAMI again here, with their voter registration and voter rights information on their websites. We've also worked with League of Women Voters, to shout them out again. There's a number of vote-based websites, I think vote.gov. Here in New York, we have a number like NYC Votes, other organizations that put out information. And I'm happy to share some resources that we have put together for our state, and some national resources that we've been able to see. I know Mary Jane also had a number of resources ready to send out to everyone after this, but really looking at a wide variety of areas and that cover a lot of different groups of folks who might have certain specific challenges based off of their community that they live in, or their specific situation in life.
There are a lot of great tools out there, and I appreciate the Vote for Mental Health shout out, but we don't host our own tool, right? We link to partner tools and all that. So I did drop the link, but yeah, I'm not going to give a specific pitch for one tool over another. I think there's a great set of many different organizations who have built civil tech to really get involved. So there are online voter registration tools, there are online absentee ballot request tools. I think starting with vote.gov is a great place for anyone to get involved, because if you're working in many states, it's going to help you link off to the appropriate state. And since elections are a state-by-state thing, it is hard to have one central place for everything. So vote.gov is a great tool. If you're looking to do voter registration, again, a shout out to National Voter Registration Day. October, I'm looking at my whiteboard, 29th is Vote Early Day. So if you are in a state that allows early voting or in-person absentee voting or other types of voting that help you have different options, because Election Day is not the only day to vote, it's the last day to vote. So there are a lot of options in different states. They have a state-by-state map, and they're always looking for community partners to get involved and spread the word to help people vote early. I will say there are also tools from other organizations that are more guides to help navigate some of this. So Bazelon Center for Mental Health Law has a great guide that we leverage for certain types of navigating some state laws around adjudication. The Department of Justice has a state-by-state guide around restoration of voting rights after a felony conviction, state-by-state. These are just additional tools. So actually, we have some of these linked at the bottom of voteformentalhealth.org/resources. So you can find some of those links all in one place.
Appreciate all these great resources, and the panelists have shared with us some resources we'll also be sharing after the webinar, and along with the recording of this presentation, awesome presentation. Speaking of steps, what concrete steps can people take today to advocate for voting rights and engage their communities?
I'm going to make a self-serving pitch here. The first thing you can do that's super easy is if you go to voteformentalhealth.org, take the pledge to vote for mental health. It's a non-binding pledge. It just says, hey, I care about mental health. I want to stand with this. I'm going to remember the impact of my vote, do my research, and turn out to vote. Just having people do that first step of hey, I'm going to do this helps turn out so many more people. In the 2020 election, which we all know was a very challenging one because of the pandemic, navigating a lot of different changing voting laws, we found that 96% of people who took the Vote for Mental Health pledge turned out to vote that year. And 85% of all pledge takers voted early. So they heeded our messaging. Do some of your research and connect with your community organizations. Find the partners you're already working with and say, hey, what are you doing? Are you sending out information? Are you connecting with your local polling places and sharing how to find that? Just that, hey, what are you doing to people you're already connected with and coalitions you're already working with? Probably will start uncovering, hey, we're actually doing this. We're hosting this candidate forum. Do you want to sign on? We're going to talk about all these issues in a nonpartisan way. That is a great first step. And then it's just doing your research, seeing what's on the ballot in your community, and just helping people get out to vote, whether that is creating a short little form that people can fill out that really goes nowhere. I've got a paper one right here that just helps people make a plan to vote. Just the act of thinking about it gets people involved. So that one was a little less succinct than others, but I think there are a few good places to start there.
Yeah, and I would say, I think, for me, it's four things. I think one is do your research. So go to those resources, get the information. Two, register to vote. Three, make a plan to vote. I think that's the one that I cannot stress enough, is making a plan to vote, thinking about the obstacles that you might have, thinking about, for example, I think that the best example I always hear is for folks who have, who sometimes struggle with depression and getting up out of bed is a little difficult. Maybe thinking about how to get your early voting in, or, a mail-in ballot if your state allows that. Thinking about that plan so you can ensure that you'll vote no matter what happens on the day of election. And then the fourth thing, which is the most important, tell your friends and family and community about it. Just having the conversation about, well, I'm planning to vote here. What are you thinking about? Really can spark those conversations and spark the thought in other people. And I think getting at that super local level of just talking with your friends, your coworkers, your community about, have you had it? Have you registered to vote? Do you have a plan to vote? Not getting into the politics or anything like that, but really just, have you thought about the plan? Have you considered what you're going to do for it? I think is a massive first step. And I think if you do those four things, you can probably get yourself to vote, but also a few more people as well.
Awesome. What would you say to someone who feels their vote doesn't matter, or that the issues important to them, such as perhaps healthcare or mental health, are not being addressed?
Well, I think that to answer the second one, I think the number one thing is they can't be addressed unless you put someone who's willing to address them in there, right? So I think finding a candidate that you agree with, or a candidate that you think can be your champion, is massive, in voting for them and letting them know that you voted for them sometimes. And, I think voting, as the process of civic engagement, voting is one step. It's a very important step, but, it's important for us to remember that there's a longer, more in-depth process that goes on throughout the rest of the year, throughout, the 4 years between each of these national elections, or I guess technically 2 years between these national elections. But really, voting for someone, and then also meeting with their office, talking to them, sending them information about how you would hope they look at this, and sharing your story and why you think that this needed change and healthcare needs to be there. You can't make that change without putting the right people in there and then having those conversations with those people. So that's what I would suggest to folks.
I think it's tough. I mean, we do this for a living, and it's tough to see, right? We want to see so much more progress. We always want to see more progress. There's so much to fix. There's so much to do. But, we can take this one step. It can be difficult sometimes. People try to put in barriers. There are barriers that naturally exist. We can take this one step. We can use our voice, and we can continue to share our stories. We can send all of the one-pagers out there we want. We can send all of these in-depth policy proposals, but facts support and stories move. If we go out, if we go ask questions at candidate events, and we go to all of the candidates in a particular race, and we ask, this matters to me, this is my experience, what's your plan to address this? We start having these, and one by one, more people share, more people express why this is a challenge in our community. And after a while, these candidates, they become elected officials, and they remember these conversations. And then we go back and we keep going, and we keep sharing these stories and our perspectives, because our lived experience is right. And using our voice in this way is the only thing that will truly create change. If they're not hearing from all of us collectively as a community, it's easier for people to just move on. And I've got too many other issues to focus on. So yes, it can feel tough, but voting is that first step in changing the systems we want to change. And that's why it's also important to take a break. You can't go 100 miles an hour all of the time, especially during an election season where every 5 minutes you're getting a push notification or you're doom scrolling in between your meetings. Take a break, acknowledge the feelings that you are having because of this. Maybe put your phone in a different room before you go to sleep, you know, those little incremental things. But we're all hopefully in this for the long haul because we know so much more is possible than what we have now. And if we take care of ourselves, we can make mental health a priority. So take that break, but realize we can make a difference. It's just going to take that one foot in front of the other to do it.
Love it. Absolutely love it. What's one action you would encourage everyone listening to this panel to take after this webinar to support their own voting, their own engagement, and one action to support others?
All right. One action to actually vote yourself is voter registration deadlines are moving quickly. Make sure you are registered. Make sure you are registered even if you know you've registered. Make sure you re-register if you have moved or changed your name. If you went from a different apartment recently, make sure you are registered, because unless you're in North Dakota, you need to make sure you are on the ballot, on the voter rolls to cast your ballot. So do that. The first deadlines are the first week in October, I believe. So you have a little time, but not that much time. So do that immediately. Second part is share resources. We all have networks. Send an email with just voter registration information. Share vote411.org, where people can look up what's on their ballot or look up their polling place. Share voteformentalhealth.org if you would like to educate people about mental health and voting. But share those resources, whether that's social media, whether that's via email, whether that's just face-to-face conversations with people. That is the one thing you can do to make sure that others are getting involved.
Yeah, I second the register yourself and make sure you are, make sure you know your deadlines for registration, and then share that deadline and the way you registered with your community and your friends. Really that quick word of mouth as well as emails, share the other information that you have, but really making sure that you talk to your friends and family members, coworkers, whoever listens to you, ask them whether they've registered to vote and let them know where they can register if they haven't.
Awesome. What about how can attendees stay connected with nonpartisan advocacy groups that work on increasing voter turnout?
Yeah, I would say definitely utilize some of the resources that we have shared. I very much will always recommend League of Women Voters. They're a phenomenal national organization with chapters that are statewide as well as very local chapters, county and city specific. And they have a host of phenomenal resources on their websites and in person, do so much great work. So I would definitely recommend them as one great organization to partner with.
Echoing that, Lee, we know so many of our local NAMIs. So we've got NAMI organizations in 49 states plus DC and 650 communities. They're going out and they're partnering with folks too. So connect with your local NAMI, nami.org/local, but also connect with your local League of Women Voters. They do this year after year. They are a powerhouse. And it's great to see because their whole goal is helping people turn out to vote. The other thing would just be find the organizations that you do care about and visit their websites. I know that can seem so simple, but people add so many resources over and over again, year after year. Maybe they create something new. Maybe they now have a section on elections. Maybe you care about mental health and voting and you want to check out what NAMI is doing. We have all of these pieces together. So sometimes it can be as easy as, I really care about this organization. I want to see what they're doing this election, and just doing a little of that research yourself.
Great. What are some ways in terms of sustainability? What are some ways that we can ensure that voting remains accessible and inclusive in future elections?
Yeah, this is a really, really good question here. I think one specific area that I have been very concerned about is around folks who are deaf and hard of hearing. There's a real lack of accessibility for voting for this community, as well as those who have that confluence of multiple disabilities or conditions, challenges. So making sure that, one, you're interacting with those elected officials after they get elected, but also really talking to some of your local voting groups, like each board of elections is also a really great way to connect about voting resources in general. But you can also work with them to really find ways to bridge out to communities that might not have voted as much. Your local board of elections is always really trying to increase voter turnout, and they're a group that is nonpartisan and want to make sure that they can make things more accessible. So beginning a conversation with those board of elections is one really big way to do it. We've gotten information from board of elections in registration forms in multiple languages, like 50 different languages out of the board of elections. And in New York City, NYC Votes is another government organization that is nonpartisan and is really all about increasing voter turnout with a specific look at folks with mental health and substance use challenges, as well as other disabilities and conditions.
I dropped a link by accident too early in the meeting chat, and it is the election protection hotline. There is a hotline, a nonpartisan hotline, in which they can provide support day of elections to navigate some of the questions about accessing the polls or challenges people are facing. They have a team there. They have a chat online. They have phone numbers in multiple languages. They are a resource, but I think one of the things is, a lot of times we don't really think about how the ADA protects access to voting. So familiarizing yourself with some of the protections and required accessibility at polling places. So I dropped a link to the federal government's ADA website, specifically detailing some of the legal accommodations that should be available for anyone accessing a polling place.
These are all really great resources and just great information and great advice for us to all follow. In coming to a close, I'd like to ask any last thoughts that you feel are important in order to move us to action or engagement. What are any final thoughts that you might have?
I think for me, the biggest thing is for folks to really stop and think what is important to them and why. If they want change, what is the change they want to see, and begin there before really looking at the voting and all these other policies. I think it really begins with you and your community. What do you want for your community? What do you want to change? And then sort of branch from there, thinking about how can you do that in a policy perspective, or getting information about how you could do that, or who is interested in doing that, what groups are really focused on that. And then, as Brandon said, if you have that connection to that group, they likely have some voting resources or information about how to advocate and who what your elected officials are doing about this issue and how to approach that, and then think about that when you're going to vote and determining that decision on how to vote, but also thinking about, that plan to vote specifically.
Having a plan is so important. And sometimes those of us who are most connected into maybe politics or elections or the policy making process, we're all here because we care about it. But it can seem so common sense sometimes. It can seem that of course, it's election day. We're going to go vote. We're going to go to the elementary school. We're going to cast our ballot. We're going to get our sticker. We'll probably post it on social media and we'll move on. But it doesn't end there, and everyone else can't see that it doesn't end there. Don't assume that this is so common sense for everyone. Voting is complicated sometimes, even if it is so easy. It's a choice that we make to decide our communities, to decide the shape of a whole lot of things, especially mental health. So my big final thought is just, let's make this easy for people. Let's lower the barriers by sharing information, by not holding it so close, because of course I know where my polling place is. I assume everyone knows where their polling place is. Sharing some of that information can make such a difference. So just taking it back to that 101, the how a bill becomes a law prequel, how we get even further upstream there, and just help people know that we've got an election coming up. Get registered and make your plan to go to the polls.
Couldn't get my mute button to go there. Thank you. Thank you all so much for those great final thoughts. And really, thank you to our panelists, Brandon and Luke. We really appreciate all this great advice and your advocacy and great leadership in all that you do. And also, thank you to Mary Jane and Eunice and all the support from all the members of the APHA mental health section and APHA CHW section. Great collaboration. Thank you all for joining us today. Thank you for engaging, and thank you for sharing information with everyone and creating a plan. Thank you for getting out there, and thank you for going out and vote. So thank you for joining us. The resources, power presentation, everything will be sent out. We appreciate. Mary Jane, do you have any final thoughts? Any final?
Well, I just want to say thank you. This was great. I learned so much. Thank you. Thank you very much. I've got a ton of notes for myself to do. Mary Jane, go do this. I hope everyone has gotten as much from it as I have. Appreciate it, and I hope we can continue to partner in some way to reactivate this community to be involved in the long term and the short term to really get it. Thank you.
Absolutely. Thank you all so much. Have an awesome day. Let's go out and vote. Take care, everyone.
Thanks all.
Take care, y'all.
Great chat.